So, Helen, can you tell me about some of the work you've been doing recently, perhaps focusing on one really moving story where we've been able to help?
Oh, yeah, there's lots of those. I think a key one that I've been supporting at the moment is Andrew. Andrew is 42 years old. He's just been diagnosed with a glioblastoma, which is the most lethal of brain tumours. With treatment, you're looking at probably 9 to 15 months. Without treatment, probably around 4 months. Andrew is recently divorced. There's a lot of anger in the relationship because he's no longer able, he can't afford to pay maintenance for his 3 teenage children. He's a carpenter, but because he can't drive, he's lost his job and a lot of work that came with that. He's living in rented accommodation, so he doesn't have space to have his children round for any length of time. They can't stay over. He's also very isolated. He's geographically remote from his 2 brothers and his parents. So, he's living with a huge amount of challenges. There's the pressure of teleological time. He's got the sense that time is running out. He's not going to see his children flourish and thrive and become the young adults that he was hoping. He's also got the knowledge that he's going to have progressive cognitive and neurological deficit. And then there's all the anger, the heightened states of emotion that he has. He feels guilty. He feels sad. He's a traditional man's man, wants to provide for his family, but he feels he's been robbed of all of that. So he's facing a lot of challenges. And of course, every conversation he has when he goes into hospital tends to be around his treatment and his symptoms, not the larger existential problems that he's dealing with. So I think, what we can do in our role with working with healthcare professionals is, if you like, close the gap between the patient and what their needs and wants are, and help healthcare professionals begin to work with these patients, dealing with what's important to them. So what we'd like is Andrew to feel that he's having his best possible day, no matter where he is on this journey. But we can't do that alone, and we like to work in collaboration with healthcare professionals. The way we close this gap, I suppose, is through our coaching model.
And what does that look like?
Okay, so all of our support is rooted very much in coaching principles and strategies. Our support specialists are trained coaches. So every interaction we have we probably ask more questions than we're asked. We listen intently to hear what's really sitting behind the words of somebody that's talking to us. And all of this, of course, aligns with the NHS 10-year plan, which is about patient-centred care. So a typical conversation with somebody like Andrew, we would elicit from them what their values are, what their appetite for risk is, what's important to them, and what are their goals for the short to mid-term future. Where do they want to be? How do they want to be as a person? What's important to them? What relationships are important to them, what those might look like. And crucially, I think the question we always ask most is, what are you struggling with the most? And once we've elicited this with our patients and caregivers, then we can begin to put together a care plan, and ideally work together with their healthcare professional, sharing some of our resources. So our goals really are to reduce isolation, to help the patient or caregiver be involved in their care pathway so that they have a sense of control and they feel supported and they know where to go for resources.